I'm Dr. Jeanette Fuller. I'm a clinical psychologist and I work in the Memory Assessment Service in Luton and Bedfordshire. Psychosocial interventions is a really broad term, but it generally refers to different ways to help people overcome challenges and maintain their mental health. That might be either alongside or instead of medication. The general aim is to help people to live well with dementia. Psychosocial interventions is a really broad term, but it generally refers to different ways of helping people to overcome challenges and maintain their mental health. That might be either alongside or instead of medication. The general aim of these is to help people to live well with dementia. These focus on helping people to come to terms with their diagnosis, helping them to make sure they can maintain their social interactions and their relationships. It might involve helping people to kind of work on their thinking skills and a really good focus on improving quality of life. It might involve working with the person with dementia, but also can involve their family members or other carers. There are a number of different types of psychosocial interventions. Not all of them are relevant for everybody, so decisions would be made about which ones would be most suitable depending on the person's needs. The types of interventions might involve working on your thinking skills, so that might be something like cognitive stimulation therapy, reminiscence therapy, occupational therapy, or speech and language therapy. There are also things for younger people or people with rarer types of dementia that are more focused on those types of dementia. There are also interventions that focus on improving quality of life, so that would be groups for people with dementia. That might involve walking groups, arts groups, dementia choirs and involvement groups, or interventions that are around sort of maintaining your independence, so things around occupational therapy and assistive technology. And there's also support for family members. That might involve post-diagnostic counselling, some specialist talking therapies, and other kinds of support groups, as well as helping people have really difficult conversations about planning for the future. There are lots of different kinds of psychological support that can be helpful. One of these is something called cognitive stimulation therapy. That's a group therapy over a number of weeks that helps work on things like maintaining memory skills or communication skills. And that's shown to be really helpful for people in the mild to moderate stages of dementia. And that's something that we do offer across Luton and Bedfordshire. There's also some specialist talking therapy, so things like cognitive behavioural therapy, which focus on helping people overcome some of their difficulties, particularly related to some of the mood problems that can be associated with dementia. And there are other types of specialist therapies like family therapy, which can give people a really important space just to have conversations around how dementia can affect them all in a family or a caring situation. And there are other things like general counselling or longer term psychotherapy if that's felt to be helpful. There's also something called post-diagnostic counselling. That's a really important space for people to get information around what they might want to expect with dementia and knowing what support's out there. So an example of that are these videos really. It's important to have these conversations early on so people can understand what might be coming in the future and then they can plan for what to do in those situations. So, for example, there are some groups that are run by the Alzheimer's Society or local carer organisations which provide information about dementia, talk about ways to cope with some of the challenges, advice and tips for improving memory and thinking skills, and also just a space to kind of process what it's like to be given this kind of diagnosis. Some general advice would be, in the first instance, to take some time just to process what it's like to get a diagnosis of dementia, to really think about what that might mean for you and to learn a little bit more about that and the support that's available to you. There are some lifestyle changes that can be important as well, so keeping physically active, trying to reduce your stress where you can, think about social interactions and keeping socially active, and also how you might want to share this diagnosis and communicate what's changed with people you feel really comfortable with. A really important thing to think about is sleep. So sleep can be really affected by the changes that happen in the brain with some types of dementia. And sleep is really important to helping our thinking skills, but also managing our mood and some of the challenges day to day. One thing we think about a lot is something called sleep hygiene. So that's some advice and some tips about how you can change your sleeping pattern, your environment, and some ways of relaxing and things like that, so that you can try and increase your chances of getting the right amount of sleep that you need to help your brain function as best as it can. And a really common thing that can happen is people really understandably will give up on things that they start finding really difficult or challenging. One thing we would really stress is to try and keep doing as many tasks as you possibly can, even if they take a little bit longer or they're a little bit more difficult for you right now, because that helps kind of keep the brain healthy for as long as possible. It might mean that you have to do things a little bit differently or have support from other people to do things, but we would really advise that you try to keep active as much as possible and keep that brain really working. In terms of accessing support, some of these things will be discussed with you at your feedback appointment. So they will give you some information about what support is out there for you and where to start. A really good starting place is usually something like the Alzheimer's Society or some of the carer organisations in Bedfordshire, such as the Memory Navigation Service. They'll be able to give you lots of information and advice about what you might want to start with and try first of all, and also what might be available in the later stages of dementia. And over time, needs will change, so what might be helpful at the beginning of the process might not be so useful towards the end. So we would say that you can keep in regular contact with your GP and other people that are helpful for you, and they can make referrals for when things might become a little bit more difficult. So for example, you might need some support from a community mental health team. Please discuss these with your GP as and when the needs arise.